Talk about today is common skin diseases in South Asians. Things that some of you may suffer from, some of your family members may suffer from, or you know someone who has one or two of these problems. I thought we would talk about those things and what you can do to help them or to help yourself. And then at the end, if there's any questions about anything with regards to skin disease, I'd be more than happy to cover them. But let's try and go through these things as much as we can. So I wanted to shed some light on three common things that I see. So I have a fairly multi-ethnic practice in the north end of Toronto, and I have a lot of South Asians in my practice. So I thought I'd pick three things that I commonly see in my practice that the majority of patients in my practice who come to see me that are South Asian complain of. Number one is pigmentation. So either too little pigmentation or too much pigmentation. And some of you know someone who has either too little or too much pigmentation in their skin. When do we need to be concerned about this and what can we do? That's number one. Number two is hair. Every South Asian has hair issues, either too much or too little. All right, so that's number two. And number three is cancer. Just because we have dark skin does not mean we're protected from skin cancer. So I think it's important for us to be aware of some issues surrounding skin cancer, some of the practices that we actually do that may put us at a higher risk for skin cancer. So those are going to be the three main topics, but while I'm talking, if you can think about anything else that you're concerned about, just let me know. All right, so we're going to start with vitiligo. We're going to jump right into it. Are there any physicians in the audience? Just out of curiosity? Second. All right. No, okay. I'm going to try and keep this as simple as possible. If there's any technical terms, raise your hand and I'll try and qualify it. So number one thing we're going to talk about today is vitiligo. Everyone here has been touched by vitiligo, either by a family member or someone close to them has vitiligo. Very, very, very common problem. Affects about 1 in 20 South Asians. What is vitiligo? It's the body's immune system chewing up the pigment in our skin. Do we need to be concerned about it from a medical standpoint? For the most part, no. It is not contagious, it is not dangerous to us, it doesn't look very nice, but it's nothing to be significantly concerned about. However, having said that, the most important thing to bear in mind about vitiligo is that the skin that does not have any pigment is at a highly increased risk for sun damage, right? So if someone you know has vitiligo, very important that they cover up their skin as much as possible, wearing a really good sunscreen. You're going to hear the theme about sunscreen today a lot. Just because we have pigment in our skin does not mean that we cannot develop sun damage or that we cannot develop skin cancer. I have a lot of South Asian patients in my practice who have skin cancer. So important to wear sunscreen, especially if you have vitiligo. So treatment of vitiligo, very difficult. New onset vitiligo. So if you've had vitiligo for less than 1 year, we can treat it pretty readily, especially vitiligo on the head and neck. So upper body vitiligo can be treated pretty easily using cortisone creams or other variants of different creams or special treatments including light therapy. So if you know someone that has vitiligo, if you yourself suffer from vitiligo, have them see their doctor, get in to see a dermatologist. There are excellent therapies, but the key, number one, to wear sunscreen, and number two, get in early. So you want to treat it before 1 year. Once it gets past a year, it gets more and more difficult to treat. So these are two pretty typical presentations of vitiligo. Tends to present around the mouth, around the eyes, those are two common areas. On the fingertips is another common area to get it, on the toes, and then in the private parts as well. These are common areas for vitiligo to present. You can start off with 1 or 2 spots, but before you know it, you can develop something as devastating as this very quickly. It can progress literally overnight, or certainly within a couple of days to a week or a month or two. You can go from nothing to something this significant, all right? Another thing I wanted to get across is a lot of people are desperate with their vitiligo. So they go online and they find all these internet-based cures. People say, we can cure your vitiligo. All that stuff is useless. There's absolutely no truth to any of these internet-based cures. So vitiligo, go see your doctor. Everything is covered by OHIP. Don't waste your money on internet-based cures. So vitiligo, common problem. When I do get concerned about vitiligo is new onset vitiligo in a child. And it can come on quite quickly. There is a familial tendency for vitiligo. So if someone else in the family has vitiligo, there is a greater risk that you may develop vitiligo or your child may develop vitiligo. In the population among South Asians, it's about 1 in 20. If there's a family member, it goes up by 100%. So 1 in 10. So significant increase, but it's certainly not 100%. It's about 10% of individuals with a family history will ultimately develop vitiligo. The most important thing with new onset vitiligo in children is that they be investigated for other immune-mediated diseases, autoimmune diseases. And there's a whole host of them that need to be checked out in new onset vitiligo. Thyroid disease, diabetes, a disease of a gland called the adrenal gland, lupus. These things can all run in families with vitiligo. So if someone has vitiligo new onset, it's probably worthwhile for them to be checked out for one or more of these conditions. Especially in a child, I think it's important that they be investigated for one or more of these conditions, especially diabetes. But all of these conditions can coexist with vitiligo. As I said, therapy for vitiligo is difficult, but here's an example of therapy. Now, we've cheated a little bit in this patient in that this guy actually still has vitiligo. This is makeup. So makeup is probably the hallmark of therapy for vitiligo. It works amazingly well. There's a couple of websites. I think the PDF is on your website, the Hindu Temple's website. There are some good makeup resources out there for covering up vitiligo. I'm not saying that we cannot get it under control. Creams can be useful, but in the interim, because it can be socially devastating for some individuals, I think makeup can be a very good adjunct treatment along with using medical therapy. So don't forget about makeup. So this is makeup and it works amazingly well. Permanent tattooing as well, and I do send some patients for permanent tattooing. I remove a lot of tattoos in my practice as well, mind you, but I also send patients for permanent tattooing sometimes if they have vitiligo in certain areas that really bothers them. The issue with tattooing, of course, is that that skin doesn't tan properly in the summer, so you have to be careful about that. So the most important thing about vitiligo is sunscreen, sunscreen, sunscreen. Very important because that skin is at a significantly increased risk for sun damage and therefore for skin cancer. Here's Michael Jackson. Everybody here knows Michael Jackson. Here he was in '77. Here he was in 2006. Dark brown skin, whiter than snow skin. How does this happen? So there is a compound called monobenzyl ether of hydroquinone, or benaquine as it used to be called, as it's still called, which depigments the skin. So you apply it, and you have to apply it pretty much every day or twice a day for about a year or a year and a half, and you can achieve almost complete depigmentation of the skin. It's no longer available in North America. In fact, it's no longer available in India either. And the reason it was removed from the market was that not only does it increase the risk for sun-related skin cancer, but the main ingredient in here is benzene, and benzene is a bad compound, and benzene causes cancers. Not only skin cancers, but also internal cancers as well. Therefore, you can imagine you're trading in a cosmetic problem, theoretically, for a medical problem. Although there are thousands of people out there who've used this product, but I'm not exactly sure what the statistics are as far as ultimate development of cancer. Now, having said that, in India, of course, like anything else, if it's not available, you can always get it on the black market. So it's available commonly in India. You can pick it up at the corner store, probably, I'm not sure, but I'm sure you can pick it up anywhere. It's very difficult to find in North America. It's indeed still, in fact, available in pharmacies in Mexico, actually. So, interesting. But this is a dangerous compound that increases risk for skin cancer. And the reason I put Michael Jackson is here, he's been well known to have used this compound for depigmenting his skin, and he suffered from vitiligo. So we're done with vitiligo. Now we're going to talk about common things that we see, especially in children, that some of you may have come across in your own children. In fact, I just saw a photo of myself on my parents' fridge when I was 10 years old today, and I have this condition. This is called pityriasis alba. Pityriasis alba is a condition that I see often in my practice, and moms and dads can come in and say, oh my God, does my child have vitiligo? And in fact, many doctors are concerned that this may be vitiligo. This is not vitiligo. This is a common problem seen in children, especially South Asian children. We tend to notice it more in the summer when the skin gets tanned a little bit. These areas do not tan the same way. They tan a little bit, but they're a little bit lighter than the rest of the skin. They're usually circular. They may have a little bit of scale on the surface. This is thought to be a mild sensitivity to a fungus that lives in all of our skin. It lives in all of our skin, but for some reason, young children, especially South Asian children, this develops. It's called pityriasis alba. Nothing to worry about. So if one of your children or grandchildren has this problem, absolutely nothing to worry about. It's just going to go away. It's going to get better with time. Use a little bit of sunscreen, put some moisturizer, but do not worry about it. Sometimes I use mild cortisone creams, or there are some other creams as well, but in every instance, basically what the parents want to know is this vitiligo or is this not? Vitiligo looks like snow. It's chalky white. This is off-white, as you can tell. So this is nothing to be concerned about. I am sure every one of you has probably seen this, not in your children or someone else's child. Fungus. This is another common problem. I'd be surprised if a few people here in the audience does not suffer from this right now, or if you don't know someone who suffers from this. This is called tinea versicolor. It's a fungus that shows up on the body. It can show up in two different ways. It can either look dark brown like this when it's active, and when it becomes inactive, it becomes this sort of pale, sort of mottled, sort of whitish discoloration like this. This fungus removes the pigment from the skin, So if you walked outside without your t-shirt on and you got a little bit of color on your skin, these areas would not tan the same way. So you end up with these lighter colored patches in the skin. A very, very, very common problem. Not vitiligo, so this is a type of fungus called tinea versicolor. This usually requires an oral antifungal to be treated. There are some over-the-counter antifungals that you can try. There are some prescription topical antifungals that you can try. They don't work so well. It always comes back. So go see your doctor. If you or someone you know suffers from this condition, which is actually quite common, go see your doctor and they need to be treated with an oral antifungal for getting this under control. So tinea versicolor, very common problem and fairly easily treated. This is something else that's quite common, and I'm sure some of you suffer from this. These are little white dots, usually noted on the shins, on the lower legs, on the shins, or on the arms. This is a little bit of pigment dropout. It's got a very long name called idiopathic guttate hypomelanosis. Idiopathic means the doctor is an idiot, he doesn't know what's going on. Guttate means raindrop, and hypomelanosis means loss of pigment. So this is loss of pigment, raindrop loss of pigment. Typically seen on the extensors, on the arms and legs. This is related to chronic sun exposure, chronic sun damage. So this is a sign your body is telling you, whoa, hang on, you've had a lot of sun exposure. You may be South Asian, but you know what? I think it's time to cool it a little bit with sun exposure. Wear a sunscreen or wear some long pants or long sleeves. This is an early sign that your body's trying to tell you that you've had too much sun and you've got some sun damage happening. So you get pigment dropout. The pigment just says, I'm done, I'm not making any more pigment. So you get pigment dropout. Idiopathic guttate hypomelanosis. So wear a sunscreen and be aware of this. Look at your skin. If you see some of these spots, just be cognizant of the fact that maybe you've had a little bit too much sun exposure over the years. All right? That was too little pigment. So now we're going to go on to a little bit too much pigment. So this condition is called melasma. This is a common problem amongst South Asian females. Typically, I see it in females between the ages of about 35 and 50. Uncommon postmenopausally, but very common in young South Asian females. The most common cause is pregnancy. So you've all heard of the mask of pregnancy. Hormones of pregnancy can cause pigmentation, not only on the face, but also on the body. This pigmentation can start up during pregnancy, but even after you've had your baby, it persists. It just sticks around and does not go away. If you measure hormones, the hormones are normal. They're not abnormal in these women, but for some reason, whatever level of hormones that you have are significant enough to cause this pigmentation. There is some predisposition in South Asian females for developing this sort of pigmentation. Other causes are birth control pills, so hormonal supplements, birth control pills. Third cause is, we don't know, it just happens. One of the idiopathic, doctor's an idiot. So it just happens. Very, very common problem, this condition. So again, treatment, difficult, but sunscreen is the first spot to start. Wearing a sunscreen can help to slow this down, and in many instances can actually reverse this. In the summer, this tends to get worse. In the winter, it tends to lighten up. There are a variety of treatment options that you can get from your doctor for this condition. There are some creams that your doctor can prescribe you, some skin lightening creams with some vitamin A, vitamin C. There's a compound called hydroquinone, which can help to lighten the skin. So you can see your doctor about it. He may or she may want to refer you to a dermatologist. There are some excellent treatment options for this condition. You're going to go online and type in melasma, and you're going to get all kinds of crazy things online for hundreds and thousands of dollars. Don't buy any of those things because A, they don't work, and B, they're very expensive. There are medical treatments that are available for the management of vitiligo, or of melasma. So if you or someone you know suffers from melasma, go see your doctor. Very, very easily treated. All right? This is from picking acne, and I see this every day in my practice. Teenagers and individuals in their 20s or even 30s picking at their skin, and they get post-inflammatory pigmentation. I tell my patients, darker skin patients who have acne that pick their skin, every time you touch your face, that spot's going to be there for another day. And that's indeed true. And you tell your kids that as well. Stop picking because you're going to get a mark. And I finally realized it, not that I'm a doctor. My mother used to tell me this when I was a teenager, and I never listened. So indeed, this is absolutely true. Don't pick at your skin, because if you do, you're going to get a long-term area of pigmentation. Acne itself lasts a month or two, it'll go away. With proper treatment, it can last a week or two and go away. But the pigmentation can last months and months and months. Typically, fortunately, it goes away on its own, but there are some good treatments available that you can get from your doctor. Again, wearing a sunscreen is important. So, post-inflammatory hyperpigmentation, very, very common problem, especially from picking at acne or other inflammatory things in the skin. But the most common thing that I see it from is picking acne on the face. All right, so post-inflammatory pigmentation. I think this is the final pigmentation thing that I'm going to talk about. This is an interesting thing called notalgia paresthetica. Complicated name for something that is caused by something very simple. Being sedentary, not getting off your butts, sitting on the couch all day and relaxing too much. Why does this happen? And this happens, to be honest with you, to a lot of people, and I'd be surprised if a couple of people in the audience didn't suffer from this right now. So this has to do with the way the nerves come out of our spinal cord. When the nerves come out of the spinal cord in the back, and before the nerves come out to the skin to provide sensation to the skin, they take a 90-degree turn before they come out to the skin. When you sit in a slouched position, now I see everybody sitting up straight, but when you sit in a slouched position, the back curvature, instead of being like this, goes like this into a C. So that angle goes from 90 degrees to maybe 70 or even 60 degrees. So the nerves get kinked. And there's a focal point just around the shoulder blade, usually the left shoulder blade, more often than the right shoulder blade, but just in that area, you get kinking of this nerve, and you get this focal area of itch or burning or pain or tingling, subsequent to which, from rubbing or picking or irritation, you end up getting pigmentation. So I see this so often in my practice, very, very often in my practice. So the most important thing is to lose a bit of this, to improve the muscles in your tummy, improve the muscles in your back, sit up straight as much as you can. We're all on our computers all day, sitting like this and hunched over like this. So important to try to sit up straight. Get one of those obus forms if you can for your chairs. Sitting up straight, it's going to be helpful not only for your back, but it's going to be helpful for all kinds of things. But getting off the couch and walking and getting some exercise is very important. But this is something I see commonly in my practice. I see it every single day in my practice. And curiously, it seems to be more often seen in South Asians. I guess we're lazier than the rest of them. I'm not sure why. But you know what? It's curious to me. Maybe just our nervous the innervation in our back is more sensitive to this sort of postural change. But very, very simple to treat. So improving your posture and exercising can improve this condition. If you are someone who has this, just let them know to get off the couch and this will get better. Sorry, one more thing. Dermatosis papulosa nigra, another pigmentary change that I see often, typically on the face. The common name for this is a skin tag. So these are little dangly pieces of skin that you can get around the neck, under the arms, sometimes on the chest, but also often on the face. And I'm looking around to see if anybody has this in the audience, and a couple of you do. So this is a common problem. Very, very easily treated, but most importantly, they're not dangerous. There's no risk for cancer with this. This is not a pre-cancer or a cancer. It's not even caused by sun exposure. It's just caused by genetics. You get them because your parents have them, and your children are going to get them. They're not going to be too happy. So it's just one of those common things that happens. Very easy to remove. We use a little laser and laser them off, and they're simple to get rid of. So you'd have to pay for it. It's not covered by more of a cosmetic procedure to remove them. So if you don't like them, go see your family doctor. Get in to see a dermatologist. Very easy to get rid of these things. Dermatosis papulosa nigra, also known as skin tags, very common problem. So that's it for pigmentation. Too little and too much pigmentation. Lots to take in. Now we're going to move on to hair. Hair loss in women. This is a very complex and difficult issue. And whenever I mention this, certainly every female in this audience and every male who's concerned about hair loss, we're all concerned about hair loss. No one has enough hair in their head. Doesn't matter how much hair you have, you want more. all right, men and women. And this is a problem that I see every day in my practice. I have patients in tears in my practice because they don't have enough hair on their head, and it's relatively common amongst South Asian females. And it can actually start fairly young. You can start when you're in your teenagers. 18, 17, 18, it can start. Most often I see it in women who are perimenopausal, so in their late 40s, possibly their early 50s, and certainly postmenopausally I see it quite often. So it has to do with hormonal changes. We know it has to do with hormonal changes. However, whenever I measure hormones in the majority of females, I find that their hormones are absolutely normal. There's nothing abnormal with their hormones. So what's going on? Unfortunately, South Asians are blessed with too many receptors for these hormones. So our hormone level may be normal, but our hair follicles seem to think that there's more hormone than what's actually in their bloodstream. So hormones, the way they work is they attach themselves onto a receptor. It's called a hormone receptor. Then the receptor hormone complex goes on and mediates the effect of the hormone. We've got this much hormone. We've actually got this much hormone, only this much receptor. But if you've got more receptor, then that hormone is going to bind a lot more because you've got more receptors. So in South Asians, especially in females, they've got a much higher density of hormone receptors, especially in the hair follicles. You cannot change the number of hormone receptors. It's within us. It's in your genes. So there's nothing you can do to change the hormone receptors. So what can we do to treat this? Like I said, I started by saying this is not a simple problem to treat. So one way we can try to treat it is by increasing blood flow to the scalp. So there are ways of increasing nutritional supply to the scalp. So there are some topical agents, and some of you may have heard of this. Rogaine is a commonly prescribed and commonly used topical agent. This can increase blood flow to the scalp. It can help. It's not great, but it can certainly make a difference, and it can slow down the hair loss in a significant number of women. It can help maybe as many as 10 to 15% of women, slowing down the hair loss. All right, so that's number one. Number two is we can try to reduce the hormonal load. We can't change the receptors, but we can reduce the amount of hormones. So there are some ways in younger females we can try certain birth control pills for reducing the hormones, and in postmenopausal females where we don't want to use birth control, there are some other medications that can be used for gently reducing the hormones. So the combination of pills and topicals may be useful for hair loss in women. So if you or someone you know suffers from hair loss, have them see their doctor and maybe see a dermatologist, because there is something out there that may be helpful. All right, I can't guarantee you, but there may be something out there that can be helpful. So that's male pattern baldness in a woman. We call that androgenetic alopecia. There's another kind of hair loss called telogen effluvium. Telogen effluvium is different from androgenetic alopecia, although to the untrained eye it can look exactly the same. Telogen effluvium is a stress-related form of hair loss. Everyone in here has had hair loss related to stress. Women often get it after they've had a baby. So postpartum, you find that your hair falls out like crazy for a few months. You get a lot of hair shedding. This is a common phenomenon called telogen effluvium. Your body has just gone through 9 months of stress, and therefore deserves a bit of a break. So it's your scalp. So your hair falls out. Other things, psychological stress, if there's been an illness in the family, or a death in the family, or a personal illness, physical stress, all of these things can cause telogen effluvium. It's a short period of hair loss that can last about 3 to 6 months, and then it just gets better. So if you suffer from profound hair loss that starts up just like this, or someone you know suffers from profound hair loss that starts up very, very quickly, think about the level of stress that they've been under over the past 3 to 6 months, and it's most likely that it's related to that stressful period, and it always settles down. Common medical cause of telogen effluvium, especially amongst South Asians, is low iron. So for those of you who are vegetarian, it's difficult to get enough iron in your diet. Plant-based iron is not absorbed as well as animal-based iron. That's just a fact, it just isn't. So for those of you who are vegetarian and suffering from some hair thinning, I think it's important to go into iron supplements. Take an iron supplement. Iron supplements can make you constipated, but there are a lot of resources out there for taking iron that will not get you constipated. So I think it's important to take an iron supplement, 300 milligrams once a day or even twice a day. Especially for younger menstruating females, I think it's important to take an iron supplement, because low iron is a very, very common cause of hair loss, especially if you're a vegetarian, all right? So low iron, go see your doctor. The next physical, make sure you get your iron checked as well. Even if your iron is normal, it may still be too low from a hair loss perspective. The range is quite large. It ranges from about 20 to 300, I think, milligrams per deciliter. The number is 20 to 300. For females experiencing hair loss, that number needs to be over 100. So if you're sitting at 50, you feel comfortable, and your doctor feels comfortable that your iron is not low, let your doctor know, you know what?